Good afternoon, everyone.
This conference will now be recorded.
Today is Thursday, July 11th. This is a regularly scheduled meeting of the Central Nevada Health District. I'll call this meeting to order. Our first item of business is the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Roll call.
Chair Ken Tedford, Justin Heath, Bob Erickson,
Present.
Denise Ferguson,
Here.
Tyson McBride, Larry Rackley,
Here.
Jeb Rowley, Rich McKay, Pete Olson, Don Witten,
Here.
Tina Manzini. I just count these two. Right.
We're good?
Well, we see that Tyson McBride and Justin Heath are present via Zoom or the online version. Neither of them responded, although we talked with
And we need that number?
Tyson earlier, and we need at least one of them.
Yeah.
What's that? Earlier they could. We saw Tyson and we spoke with him, and he could hear us and we could hear him, but neither of them are responding at this moment.
Oh,
And
Give
so
'em
I think we should give it a minute to see if we
some
can't
time.
get them engaged in some degree. Even if we need to call them on a phone or whatever we need to do, just to get at least one of them here and we know they're here. Tyson or Justin, can you hear us? If you're talking, you're muted and we can't hear you. Justin or Tyson, can you hear us?
I can now. This is the first time I've heard it.
Yeah, I can hear you.
Okay. So Justin and Tyson both just indicated that they could hear us now. So
So we're good?
they're both present. So there is a quorum present.
Excuse me. We do have a quorum. Okay, public comments. No action may be taken on a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action will be taken. Public commentary will generally be limited to 3 minutes per person. Any public comments in the room? Yes, sir.
Yes. Big surprise. For the record, Bob Clifford from Fallon. Dear board members, I provided a update just of links to articles from the last month or so in the mostly alternative media, although the mainstream media is starting to pick up on this, and we'll see how that evolves. Very damning articles. I mean, peer-reviewed studies showing dramatic reductions in life expectancy, all kinds of horrible increases in blood clots and cardiac things. This shot, interestingly, in a lawsuit, the Ninth Circuit Court of Appeals has ruled that these mRNA shots are not vaccines. They shouldn't be called vaccines. Ninth Circuit, that's like one step from the Supreme Court. So this is not a minor deal. We should stop calling them that. But in a nutshell, one German study headline kind of summed it up. No beneficial effects while massively increasing excess deaths. That's what you get. And if they're not a vaccine, what are they? And there's a lot of experts out there saying that it's a bioweapon. It's designed for population reduction. This is like the biggest conspiracy in the history of the planet. I mean, you really have to start taking this seriously. Japan, not having a lot of people like we have in the U.S. that are on board with the depopulation agenda, they've banned the shots, period, in Japan. And they're experts. There's a lot of, data and stuff that they cite from their experts. So now, because it's not a vaccine, there's no immunity for the pharmaceutical companies. The immunity was for vaccines, not something else. So, lawsuits, arrest warrants, a lot of apologies from people that were involved in mandates. Since they can get sued, now that the lawsuit, this decision was in the last 30 days. So now that the lawsuits are starting to be filed against, for damages, wrongful death and that kind of thing against the pharmaceuticals. And I think that the people that are apologizing, they're trying to beg forgiveness, and so they don't get sued. So this whole thing is they need to start a world war or something to push this under the table, which is a problem because I think they're trying to do that. There's also calls for the FDA and the World Health Organization to be sued for suppressing ivermectin as an effective treatment. The data clearly shows it was an effective treatment, and their actions resulted in countless deaths, unnecessary deaths. We now have a new pandemic bird flu variant coming up. How convenient with the election coming up, timing-wise. Russians, there was a report the Russians have information of a plan to release this before the election, a false flag attack, because these are not natural, these are engineered. And in fact, some very evil people, specifically, brain's not working. One of the founders of Microsoft, Bill Gates, they funded research into how to make this transmissible amongst humans. The thing has a 25 to 50% death rate. It's way worse than the COVID. COVID's like a common cold. This thing is really deadly, and if they make it transmissible and release it, we're going to have a real problem. So they would do that to try to force vaccine mandates, but now that we know the vaccines don't work and they're extremely dangerous, I would recommend local governments not get involved in distribution of these vaccines. Don't support any unconstitutional mandates. Just don't do it. And then for the benefit of Pete, my last point is that they're calling now for testing of cattle, dairy cattle, and they're using PCR testing. And we had a lab business, and I know a lot about PCR. PCR is not designed to do this. There's very high numbers of false positives. So they come in and test, and you end up culling your herd unnecessarily. It's all false positives. So I would recommend getting, alternative testing lined up and be prepared to fight, because these guys, they're also trying to reduce the food supply. and, you know, the globalists, the World Economic Forum and those guys. And I would get prepared because you could have a major hit if these guys come in and cull your herd. And that's all I've got. Thank you very much. Thank you.
And I should say, for the records, Larry Rackley. Verification of posting of the agenda.
Amber Edwards, for the record, verifies that the agenda for this meeting was posted the 5th day of July, 2024, between the hours of 11 a.m. and 3 p.m. at all the locations listed on the agenda.
Thank you. Approval of minutes, consideration and possible action. Approval of minutes held on May 9th, 2024.
Mr. Chairman, I don't have any corrections or additions to the minutes, and if no one else does, I move that the minutes for the meeting held on May 9th, 2024 be approved.
We have a second.
For the record, this is Denise Ferguson. I second.
We have a motion and a second. All those in favor of the motion?
Aye.
Aye. Motion
Aye.
passed. I should wait.
Mr. Chairman, members of the board, for the record, Darren Winkleman, if I can jump in real quick, just to make a quick change maybe to the agenda, number 8, staff reports. Talked to the chairman last week. He would like to be here when we do those staff reports. We had the idea that each leader of the group from each department would kind of give an update. And so if it's okay with the board, we'd like to move that update to the August meeting, if that's okay.
Okay.
And then I'm going to depart a little bit again, if it's okay with the board. I'm going to let Maria Menjivar do some presentations today and give her a little experience in front of you guys and see what that feels like. So if that's okay, I'm going to turn it over to her as well.
Okay. Good afternoon.
Good afternoon, Mr. Chairman and members of the board, Maria Menjivar for the record. Should we begin? We begin?
Yes, I think we're under appointments now, so you
Do you have something that,
just, we need you to have a read number 8.
oh, okay. So appointments, consideration and possible action, reference approval of a contract with Kim Padilla for the provision of professional services to the district for services related to STD testing, screening, and treatment, Pap cervical cancer screening, birth control contraception, and vaccinations in the amount of $500 per day worked.
Mr. Chairman and members of the board, Maria Menjivar for the record. We, at the Central Nevada Health District, aim to provide the best services for our constituents and for the communities that we serve. An advanced practice registered nurse is essential for our current needs. In addition to providing services for the clinic, this contract will help us meet our current needs, and the position will be involved as a key member for the district. This contract will provide us with the flexibility to depth needed to fill our current needs if our APRN is unavailable. I welcome any questions at this time.
Denise Ferguson for the record. The price per day seems fine, like with rate of pay for APRNs, it's actually probably pretty reasonable. How many days do you kind of estimate that you would need to use that person based on vacations or anything, or volume? I mean, what's kind of your estimate on that? Do you have a thought?
Mr. Chairman, members of the board, for the record, Darren Winkleman. Yeah, we don't anticipate using very much. This was as we know, we have a new brothel coming into our system, and so those workers have to be tested weekly. And obviously, we want to be able to make sure our current APRN has a little time off occasionally, and so when she has that time off or unable to come into the office, we want to have that contract in place. I can't imagine we'd use that more than a dozen times within the year, would be my, I guess, this kind of a
Okay.
ballpark figure.
And where's the brothel going to be?
It's out
Wood
of
County?
Mineral County, but yeah.
Okay, is it the one in Mina?
Yep.
Okay, so they're just reopening the one in Mina. Okay. Just, they used to come to the hospital every week. We used to take care of them. So that's always an option, if you guys need it.
I appreciate it.
Yeah.
Appreciate that.
What do we have? A motion for approval of a contract?
This is Denise Ferguson. I'll make a motion for approval of a contract with Kim Padilla for the provision of professional services to the district for services related to STD testing, screening, and treatment, PAP cervical cancer screening, birth control, contraception, and vaccinations in the amount of $500 per day worked.
Second.
We have a motion and a sec, did you hear the second? We did. We have a motion and a second. All those in favor of the motion?
Aye.
Aye.
Motion passed. Appointment B, consideration and possible action, approval to establish a Central Nevada Health District Office Supervisor position and to authorize hiring up to step 3. Maria?
And
Mr.
I
Chairman,
think that was
members of the
step
board.
13.
What?
Mr. Vice Chair, I think that was up to step 13. I think you'd read it as 3, just
Oh,
for the record.
oh,
So you're okay.
Mr. Chairman, members of the board, Maria Menjivar for the record. Over the past year, we've determined or come to determine a need for this position to oversee office operations and to ensure organizational effectiveness within the organization. This position will play an important role in overseeing the day-to-day operations and handling functions smoothly and efficiently, in addition to developing office culture and delegating tasks and providing information laterally effectively, to be able to take care of any tasks needed on a day-to-day basis and including any administrative details within the office. I'm happy to answer any questions at this time.
I don't see, oh, go ahead.
Excuse me. I had a question for you, Mr. Winkleman. Over the last 6 months, Chairman Tedford and myself have had a number of conversations with you about the lack of administrative staff, so we support this position 100%. We're still concerned about you having administrative executive staff to assist you in your daily operation. Could you comment to that, if that's needed or not?
Mr. Chairman, members of the board, for the record, Darren Winkleman. Yes, thank you, Chairman Erickson. We looked at this position in a lot of different ways. We looked at the office supervisor, we looked at administrative assistants, kind of that administrative support for the district and how that would look. And we all decided that this particular position would give us a little bit more bandwidth in terms of what we were trying to do. We need to be looking at holistically in terms of what we have for the current administration staff, our office support staff, and then our resource liaisons, and how that's all going to meld together. And we feel that this particular position has the ability to do that, has the ability to kind of bring all that together along, kind of helping with the administrative piece of what I do daily and then what the managers and the leaders of the other departments do. And so, long story short, we've looked at all of that. We've, I guess, vetted, for a lack of a better term, and determined this would probably be the best approach at this time. But more than happy to entertain other ideas if they're out there.
Well, we just want to make sure that you have the proper staffing level to accomplish your mission, and we were concerned about that. Thank you.
For the record, Darren Winkleman, I appreciate that. We are busy. There's a lot of things going on that we're trying to manage, and I firmly believe that this will give us that. Time will tell whether I'm wrong or right, I guess. But I think right now, with what we envision as a leadership team, this will get us where we need to be in the next 3 to 5 years.
Thank you.
For the record, Larry Rackley, any other comments? We'll have a motion.
I would move to approve the establishment of the Central Nevada Health District Office Supervisor position and to authorize hiring up to a step 13.
This is Denise Ferguson. I second that motion.
For the record, Larry Rackley, we have a motion and a second. All those in favor of the motion?
Aye.
Aye.
Motion passed. Item number C, consideration and possible action. Approval for interlocal agreement between the State Division of Public and Behavioral Health, Public Health Infrastructure and Improvements, and Central Nevada Health District. These funds will be utilized to evaluate the public health needs of residents under the jurisdiction of the entity and determine the level of priority of the public health needs identified in the amount of $195,000, effective July 1st, 2024 to June 30th, 2026. Darren or Maria?
Mr. Chairman, members of the board, Maria Menjivar for the record. We bring before you Senate Bill 118 that was passed and approved during the 2023 legislative session. This bill is an appropriation to the Division of Public and Behavioral Health of the Department of Health and Human Services for allocation to specified entities for the improvement of public health. This interlocal contract for the Central Nevada Health District appropriates $195,000 for new building capital outlay and allows for this priority to change if needed. As we evaluate our budgets, this interlocal contract and agreement may be reallocated to ensure services through FY25 remain complete. Any questions?
Any questions from the board? Seeing none, we have a motion on that.
Mr. Chair, I'd make a motion to approve the interlocal agreement between the State Division of Public and Behavioral Health, Public Health Infrastructure and Improvement and Central Nevada Health District. These funds will be utilized to evaluate the public health needs of residents under the jurisdiction of the entity and determine the level of priority of the public health needs, identified in the amount of $195,000 effective July 1st, 2024 to June 30th, 2026. Pete Olson.
I'll second the motion.
We have a motion and a second. All those in favor of the motion?
Aye.
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 Motion passed. And for the record, Larry Rackley speaking. Consideration and possible action, approval of an award in the amount of $15,000 from the Silver Summit Health Plan Rural Community Investment Program for the 2024 funding cycle. Is it Maria?
Mr. Chairman, members of the board, Maria Menjivar for the record. This grant allows us to create a summer program for our youth in 2 counties that we currently serve. The intended timeline for this program will be 9 weeks during the summer months when school is not in session. Our staff is going to be teaching a curriculum-based lessons during 2 weekly sessions for a total of 18 lessons. Also, we wish to maintain and encourage interest and participation throughout the program. Staff will incorporate life skills-based games and group activities for the remaining sessions each week. And we'll provide a healthy snack for all youth participants, followed by a fun activity at the end of each lesson. Our goal is to provide the youth in our communities with a program that will present ongoing life skills, education, and support, which is seen lacking during the summer months when school is not in session. It is our objective to help reduce at-risk behaviors, health risks, and food insecurity while providing needed life skills, training, and positive group activities. And I'm happy to answer any questions at this time.
Mr. Chairman, members of the board, if I may, This grant was a competitive grant that was written by one of our office specialists, Shasta Garrison, and one of our resource liaisons, Daisy Flores. So they've never written grants before. We saw it, we said, hey, you guys willing to give it a shot? And they stepped up to the plate and said yes. We originally asked for $25,000, they awarded us $15,000. That program has started in both Pershing and Mineral counties. And so, yeah, excited to have staff that can do that sort of thing and be willing to give it a shot and risk failure. But in this case, they were successful. Just wanted to add that.
Do you know how many participants, youth participating?
I don't know. I know Mineral County has a handful. I'm not sure the number. And I think Pershing started out with 5 or 6.
Okay.
I know we were there the other day, but only one of them showed up during the program. But we figure one is better than none. And so, yeah.
Yeah, thank you.
And we can report out after that program's done and exactly how many kids we reached.
Okay.
Can you give some examples of what life skills are being taught?
Currently for the program, Maria Menjivar for the record. Currently for the program, what they are teaching is healthy and abstinence from risky behaviors for kids and teaching them lessons based on their age. So the curriculum that is being taught, I know in Pershing County by Daisy Flores, is for target ages from 10 to 14.
Everybody good? Any more questions? We have a motion.
This is Denise Ferguson for the record. I'll make a motion to approve the award in the amount of $15,000 from the Silver Summit Health Plan Rural Community Investment Program for the 2024 funding cycle.
I'll second the motion. Bob Erickson for the record.
Larry Rackley for the record. We have a motion and a second. All those in favor of the motion?
Aye.
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 Motion passed. Thank you. And we're not going to do staff reports. But Doctor, we haven't heard anything from you. Since you're sitting here.
Dr. Ted McDonald, for the record. Thank you for asking. Yeah, I fully expected that we were going to have a presentation today, and my job was to stay out of the way on there because it's going to be a good show. And next time you will have reports from each one of our department heads regarding kind of a year ending, what we've done over the year. My brief preview of it so far is that we are providing services more frequently than services have been provided in the past. Also services, especially our environmental services, on a more timely basis. So, some of the initial things that we were concerned about having this district formed, our expectations have been met because we are, meeting marks. It's not exactly what we want to be because we're looking for 3 or 4 years. And some of the things that came up today, especially with the supervisor's position, is to allow us to grow. And we are currently looking for environmental inspectors because we can foresee that that is the big thing coming up. It's going to be one of our major things as we move forward. My part of it, I'm pleased with our reports. A year ago, I noticed on Facebook from the Lahontan Forest Department or the Park Service, an announcement that there may be an algae bloom. We were way ahead of them this year as far as getting information out on algae blooms, mosquitoes, heat tolerance, all the different things that seasonally we hit here, dengue fever, how to protect yourself against mosquitoes. And a lot of that's gone out on social media. It's available by our websites. So our educational component, we're moving forward that. And as you saw today in our presentation, that our community health workers are taking a lead in that with these classes on how to start at a young age and prevent the things that will affect you later on. So healthy eating, abstinence from smoking, alcohol, all these different health things that are the basis of public health is to meet the needs before things hit the fan. So in the last year and in the last 14 years that I've been at least with the health district here, I am seeing great progress, and I am proud of the staff and the board for facilitating our ability to make this progress. So next week's going to be fun, or next month's going to be fun with the presentation. Do you have any questions about, like, I heard mentioned today about the avian flu, those sort of questions. There's a lot of interesting things. I'll touch that one since it was, right now 10 states are affected by it. Nevada hasn't had a case of avian flu in humans or animals at this point. Now, a couple of years ago, we did have some wild birds that had avian flu. They can also get it also. There's no mandated testing in the state of Nevada. There is testing that goes on throughout the United States, and what they're actually testing is sometimes dairy products in the stores and downstream wastewater from dairies. The interesting thing I pulled out of this is their pasteurization negates the avian flu because they've found it in products that are already produced. They found particles that are neutral now. They've been killed by the pasteurization process. So pasteurization works. There have now been 4 people that have been affected by the avian flu. Most of it is pink eye that they get and a little bit of respiratory problem. They do have medications out at this point that they've developed that are effective. No one has died from the avian flu at this point. Old numbers in the past, 50% was a fatality rate, but we never had enough people to really, have a good study on to say, okay, is it really 50%, or did we have 2 people that got it and 1 died? They're also doing informal sort of studies where they're following farm workers now that may be exposed and testing them on a regular basis to see if there are forms of the avian flu that may not have any symptoms at all. And there are vaccinations that are being developed for this. But again, like with COVID, things mutate so quickly that having a vaccination at this point, they're not making any movement to come out with anything other than an investigative study on what vaccines would work for this. Other alerts that come out that we've had is there's still a measles alert in the United States because of people traveling to foreign countries. Most of the people that, when we have measles in the United States, it's somebody who's gone to another country, has been unvaccinated, comes back, and is either sick then or transmits it to people who have not had vaccinations. But there's not big numbers, but just enough where they're watching. Dengue fever, instead of West Nile, the United States more has a dengue fever because that seems to right now be what's flaring up. The reason why they're concerned about it is in climate change, the territory sort of change. It used to be certain mosquitoes carried certain viruses. And the mosquitoes that carried the dengue virus are mostly in Florida, Puerto Rico, California, Southern California, mostly in the warm, humid areas. But with changes in the climate, they're finding that the mosquitoes are moving more northerly. So they're a little bit more concerned about that. We haven't had any positive West Nile testing at this point, and if sometime in the future you would like to have the county mosquito abatement and noxious weed abatement group come in and give a presentation, I would be happy to do that. They've got a great presentation on the species of mosquitoes that are involved and where they're at and where they're not at. But they're continuing, they've been going through this process right now. We've released information just to help people protect themselves. So, go ahead.
Yeah, just for the record, Denise Ferguson, I appreciate that information because some of it answered questions for me, because at the hospital, we get tons of stuff on aviary and dengue, we've heard TB in certain coastal areas, but we've, probably the last month, we've actually seen COVID go up a little bit. I think mainly probably in, before the 4th of July and after the 4th of July, so I've had more positive. I don't know if at the health district, if you've seen any uptick in the county reporting. I know we just have, so I was wondering, you know, if you think that's probably just cyclical with people meeting and that kind of thing.
Ted McDonald for the record. The answer is yes, there has been an uptick, and it's not just us. I did a little bit of traveling last week and had a chance to go up to Washington and Oregon and Northern California. And they are having the same thing. People are traveling, they're getting out and about, and there have been an increase in COVID testing or COVID cases. It's mostly, and it's probably underreported, because in a lot of states, they get sick, they go, well, I'm not going to do anything. But there are a few people that'll go in to be tested when they have travel plans and decide not to. So that's the numbers that we're seeing. Nevada has decided to continue to do their reporting. They sat down and just decided that we still want as much information as possible. So they collect lab results and anything that comes through that's through a hospital that's positive. So Nevada is one of the exemptions, because the United States has said, well, you don't have to. But we're still monitoring at this point. And the Candida aureus infection that they had down in Las Vegas, and I think there's been 1 or 2 cases in Washoe County, seems to be at this point at a plateau. It's not getting worse, but it's not necessarily getting better. So they're still following that also.
Thank you. That's
welcome.
perfect. I appreciate it.
Thank you. For the record, Larry Rackley, any other board comments? Seeing none, public comments? Seeing no public?
Hello? No, hello, can you hear me?
Yes.
Oh, sorry. Hey, this is Jeb Rowley in Eureka. I just wanted to say I did pop on. I came in about the end of public comment at the start of the meeting. Just wanted to let you guys know I was here. Sorry, I was having technical difficulties with the Go-To platform, and wanted to let you know I was present and was able to hear the meeting and agreed with all the decisions and actions taken so far. Just wanted to say hi.
Thank you.
Thank you.
Any other public comments? Hearing none, this meeting is adjourned.